Hey, good morning, everyone. Charlie Irwin here with Careington International Corporation. I will be one of your hosts today. As far as my role here at Careington, I am the broker development manager. So we're going to have an audience here of insurance brokers. We'll also have some employer groups, some HR people on the phone as well, which is fantastic. We're certainly glad that you took the time to join us this morning. Again, I'll be one of your hosts, more on the broker side of things. We also have Daniela Biondo. She's a national sales representative. She'll also be a host here. Daniela works more directly with the HR people, directly with the employer group. So she's going to be great to have on the webinar this morning. Daniela, you want to say hi to everyone?
Hi, everyone. Thank you for taking the time to join us today, and we will jump right into our webinar. And if you have any questions, please feel free to add Charlie and I to your LinkedIn accounts. We'd love to get to know you, your business, and your employees.
Absolutely. Daniela, I'm glad you brought up questions. Speaking of questions, certainly we're going to be more than happy to answer questions for you. You do have a field that you can type out questions. For convenience, we're going to go ahead and wait till the end of the webinar to answer those questions, but keep that in mind, and let's go ahead and get going here. All right, there we go. So obviously this webinar is about Careington Direct, our new group portal, and we're going to dig into that today. But I do think it's important that we go over who Careington is, where we started, where we've gone throughout the years, and where we are today. Now, don't worry, I'm not going to read word for word of this page, but I am going to highlight again kind of who we are, especially for those people who are new to Careington. But we've been around since 1979, founded by two dentists in the Dallas-Fort Worth area. As you're going to be able to tell, we are very heavy on the dental side of things because we started off strictly in the dental space. We were the first licensed dental HMO in the state of Texas. Most importantly, if you look at 1992, this is going to be very relevant for today. That's when we launched our dental fee-for-service network, or what you might know as our dental discount plans. Shortly after, our clients started asking us, man, these fee-for-service dental plans are fantastic. Where could I go to get something similar in the vision space, or maybe prescription or chiropractic or various other ancillary benefit space? So in 93, we started bundling our dental with other ancillary products. And even today, as of today, we have over 150 different products that we can bundle together for our groups and for brokers that are offering our plans out. Fast forward to 2006, licensed TPA. So even though we do our plan packaging and dental vision telemedicine and various things like that, we can also do some TPA work. So we work with insurance carriers to do back-end administration, as well as self-funded plans we can do dental TPA work on. 2007, we started offering our telehealth products. So we've been doing telemedicine and have been in the telemedicine space for years and years. And it's a very, very important part of what we do here at Careington. So we've been selling telemedicine for a while, but over the past few years, we actually launched our own telemedicine company called DialCare. So they're technically a sister company to us, but DialCare has been amazing, whether it's physician telemedicine, mental wellness, or teledentistry. So that has been great for us. And then fast forward to today, we have over 14 over 15 million customers, and we just keep getting stronger and stronger and growing. So it has been a great ride. All right. So as you can see from this slide, these are a few of our clients. Of course, you can see the brand names, and they're very big and impressive. But more than anything, though we are proud of these customers, my goal isn't to show off or gloat, but more than anything, it's a way to show the different types of customers that we work with. So you can see Amazon, White Castle, Gap. These are employers that offer out our plans to their employees, Cracker Barrel. But we also work with, again, insurance carriers like your United Healthcare's, VSP, MetLife, that can utilize our networks, or maybe we do the back end TPA work with. If you're on the webinar today, and maybe you're a broker or you're an employer, and you say, man, I don't have as many employees as, let's say, American Airlines or anything like that. That's fine. We work with very, very large groups. However, we work with groups as small as 3 employees. And really, Careington Direct is great for groups of any size. So don't let that scare you. Certainly, groups of any size, whether you're large or small, we can help you out. All right, so Careington Direct, we are super excited for our new self-service group portal. Over the years, when we onboarded employer groups, whether it was a broker that I'm working with to onboard one of their employer clients, or whether it's Daniela working directly with an employer group to get their employees on, it was a very manual process. I've got to admit, in years past, very manual. It was time consuming. It could be very confusing. And I want to let you know, we heard your pain points. We listened to our clients, and they were asking us for a very streamlined, easy to use, quick process that they could hurry up and do themselves. They didn't have to have a lot of hand holding from us. Even though we are more than happy to hold your hand through the process, they were wanting, again, more of an easy, streamlined way to get their employees set up. We heard from them, and Careington Direct is here today. So we are super excited to let you know how you can get your employees or your clients' employees on dental vision, telemedicine, and more. All right, features of Careington Direct. I mentioned that before, but you will hear this throughout the presentation. Very easy to use. And that was something when we were creating Careington Direct. Again, we wanted something that was painless, that was easy to use. It's going to take you through a step-by-step process. Once you go to careingtondirect.com, step-by-step process of finding your plan, creating your account, which means inputting the employer information, back office, username, password, and then last but not least, uploading the employees. And then from there, we kick out a list bill, once a month list bill to the employer. Very easy to use, step-by-step process. When we say self-service, again, this is something that there's not going to need to be manual files sent back and forth, or manual contracts mailed to us or emailed to us. Very self-service. Everything from when you go on, log in, you do the contracting, you put in your information, you do everything through that portal. Very easy, very quick. and many times within just a few minutes. So it's all through that portal, and very self-service. So that being said, even though this is self-service, don't let that scare you. We're certainly here to help you. There's a customer service line that we can answer any questions about the process, or any questions that you have in general about maybe uploading your employees or anything like that. Once you have your group set up, again, there's going to be a email account and a phone line that you can call us throughout the whole process, from beginning to end. So we're definitely here to help you, and that's something we're very proud about as well. All right, Careington Direct target markets. As you can see here, whether full-time, part-time, no matter the employees, if they want to do a group list bill, we can work with them. So they don't have to even put if they're part-time. That designation is something that we don't even get. So as long as those employees are uploaded, that is great for us. So Daniela, I'm curious. So you talk with employers directly all of the time. Is this, from what this slide is saying, does this come up much? And is this something that employers are concerned about?
Absolutely. The main questions I get from brokers and employer groups are, I have 1099, or I have part-time seasonal employees. I also have full-time. How is that applicable to each and every candidate or employee? Anyone can use this plan. So if they're retired, or if it's going into a furlough package, if they're seasonal, full-time, all of our plans apply to these people. The services can be implemented as soon as 48 hours up to 72 hours. And within that time, if you have seasonal, part-time, you can add and remove employees anytime, at any point. It's as easy as uploading your spreadsheet in your portal, making those changes, and sending it back to your representative, or an email that will be listed in the Careington Direct website.
Yeah, and that's a great point. It's especially, we get this concern on the part-time employees or the seasonal contract is, hey, open enrollment for our health insurance plan is January 1st, but hey, it's, March 1st. Can I get the Careington plans? Can I go through Careington Direct? The answer is yes. So you can enroll groups. So brokers out there, you don't have to wait until January 1st, let's say, to get these groups up and going. If you have groups, I know I personally work with a couple of employers that have employees that come in and out of India for IT work. So maybe they're here for 4 months, or maybe they're here for 6 or 8 months. That's fine. They don't have to necessarily stay on for a year. So if they come in and they're going to be here for 5 months, you can upload them to Careington Direct, and whenever they leave, you can remove them. Not a problem there. All right, so who are our plans good for? I know, as a broad way of saying it, pretty much anyone, but to kind of dig in a little deeper. So if you have employees that are uninsured, so basically maybe they don't have access to any dental, vision, or telemedicine. Maybe the employer doesn't offer that at all. Obviously, our Careington plans are going to be great for those individuals who don't have dental, vision, telemedicine, or more. But maybe they do. Maybe they have a dental plan. That's certainly fine. So in that example of being, let's say, underinsured, maybe they have a $1,500 max, and 1 month into their plan, boom, something major happens. They hit their max, and they're kicked to the curb from the insurance company. basically they can no longer use that plan anymore. That's where we can come in for those individuals. So certainly if you offer a dental insurance plan, you can also offer our discount plans alongside of it. Again, in that case where they hit their maximum, or maybe the insurance plan, let's say, has a 6-month waiting period for oral surgery, or a 6-month waiting period for cosmetic procedures. If they chip a tooth, instead of waiting 6 months to be able to get the work done, they can jump on our Careington plan and utilize it right away. So, so again, whether they have a dental insurance plan already offered to them or whether they're on it or not, certainly our plans are relevant. You know, I talked about our dial care telemedicine. If they want 24/7 access to licensed physicians through phone or video consults, our Careington Direct plans, this is the way to go. Now, something that we hear every once in a while is, well, I already have telemedicine through my health insurance. While that may be true, I want to mention, make sure and see if there's a consult fee. So typically, even though they quote unquote have access to telemedicine through their health insurance, there might be a $50 consult. So anytime they use it, they have to pay $50 for it. So something to check into, because with us, there's no consult fee. So they can use it as many times as they need to, phone or video consults, and there's no fee every time that they have to utilize that. They have gaps in their traditional insurance. I kind of mentioned that on my first point, but again, if they have waiting periods or anything like that, they can come on the Careington plans, and this is a great way to meet those needs. Cosmetic dental services. Many times with insurance, it doesn't cover cosmetic procedures. It doesn't cover veneers, dentures. Sometimes the implants can be considered cosmetic. So that's where with Careington, they can save money on any of those procedures, regardless if it's something as simple as a teeth cleaning, or if it's oral surgery or cosmetic. Whatever they need to have done, they'll be able to pay discounted prices for those procedures. Last but not least, our plans are very affordable. Later on in the presentation, we're going to go over what the group plan pricing is. Our plans are very affordable. What we find out with employer groups is when they're offered dental insurance, many times the take rate on dental, vision, or some of those ancillary products, though they're offered it, many times the take rate is very, very poor. And the reasoning behind that is it's not affordable. So I have, let's say, vision insurance offered to me, but they say, man, that sure is a lot of money to pay every month, and I'm not really getting that much in return. Well, with Careington, as you'll be able to see, our plan pricing is very affordable, and they're able to save a ton of money on their procedures. All right, so now whenever you go to careingtondirect.com, I'm going to walk you through what you're going to see. When I said it's easy to use, when I said it's a step-by-step process, again, I'm going to give you more of a visual with these slides of what you'll see and what you'll do. First and foremost, we make it extremely easy for you. When you go to careingtondirect.com, big wording that says help your employees save money on healthcare, and you click get started, right? So easy to use, hard to miss that big red get started button. After you do that, it's going to show the different plans that you can get your employees on. So for now, we have 3 plans that you're able to choose for your employees. There's going to be a dental and vision plan, a dental vision plus telemedicine plan, and then a telehealth savings plan. Each plan is going to have a list of the products that are included. For example, the dental vision plus telemedicine plan It has dental vision, telemedicine, but it also has, as you can see, LASIK. It has prescriptions. It has medical information. A list of those products, you're able to click on each product in that package to learn exactly what it entails. The group pricing is on the screen, which is great. I hear this from brokers all the time. Hey, how long is it going to take for me to get a quote back for my group? The answer is immediately. There's your quote right there. So the plan pricing is right there. You're able to get back with your group. For the employers, HR representatives that are on this call, of course, you need to plan for pricing. What is it going to cost? Again, very easy and transparent right here on the screen. So get started. You'll pick your plan. And then the next step in the process is going to be registering your account. So you're going to do a username and password. That's when you will be able to put in the employer information and the agreement, employer information. Everything is going to be right here in this step. Brokers, if the employer wants you to work with them on this process as far as actually setting this up, obviously that's fine as long as they're allowing you permission. So we have many brokers that help out with this and are able to do that for the employer, obviously assuming they're giving you permission for that. But inputting the employer information again, and then the next step is loading your employees. As you can tell, it's very easy. You load them through an Excel file directly through the portal. Basically, name, address, contact information. We don't need social security numbers. We don't need a lot of things involved with that you're used to maybe with insurance plans. Because our plans are not insurance, there's no underwriting, so we don't need a lot of that sensitive information that you might be used to with insurance. One thing I do want to mention, when you enroll your employees, you're able to, maybe 4 or 5 of your employees want dental and vision. Great. Maybe 4 or 5 of your employees want the telemedicine plan. You were able to do that, choose which plan your employees are on whenever you get them uploaded. And as Daniela mentioned, 48 to 72 hours, we have the account set up. Now, it'll take a few days for the cards to get mailed and actually have the membership packet in the employee's hands. But again, very quick process, very streamlined. And last but not least, employees are set up, fulfillment is mailed out to them, and then the list bill is sent out once a month. We send the list bill out, the employer pays us, and that is really the full process. All right, here are some of the Careington Direct Plan advantages. I'll go over a few of these, and Daniela, after that, I know, again, you're talking to employers quite a bit, and if you want to jump in after I point out a few of these, feel free to do so. We had mentioned once before, but we want to, of course, go over it again. Anyone can join, no exceptions. No age requirements, no citizenship requirements. Again, don't have to be part-time, full-time or anything. None of that really matters with us. All of our networks are very broad nationwide networks. So we get this question quite a bit is, are we only in 1 or 2 states or something like that? The answer is really everywhere except Vermont and Washington. And that has to do with various regulatory requirements in those states. any employer outside of Vermont and Washington, any employee outside of those states, we're good to go. Our networks are nationwide, and we're able to service your employees and really have plenty of providers for them. I'm going to jump down and mention, so our plans are compatible with HSAs and FSAs, HRAs. So this is huge for me. When I use my Careington plans, I'm able to make my HSA go much, much further. Why? Because I go in, let's say on the dental portion, I go into the dentist, instead of paying full price, I'm saving a ton of money. For general dentistry, from my experience, it's usually been around half off for general dentistry procedures. And then I pay with my HSA card. I pay those discounted prices with my HSA, therefore making the funds in that HSA account go much, much further than simply paying out of pocket. And no limits on use. So this is another huge question we get asked quite a bit. How many times can I use it? How many, let's say, dental cleanings can I get a year? Or what is my maximum? There's no limits. There's no maximums, no limits to how many times you can use it. You're able to use it as many times as you need to. So Daniela, I know I jumped through a few of these points. Is there anything you want to add in here?
Absolutely. So another question that I get is, can children use the plan? Can I sign just an individual up, an individual and a spouse or a partner? Absolutely. Let's say that you or yourself work remotely, or you have an employee that works in New York, you have another one in California, or they're traveling within the US. Though these plans are applicable to most of the states, excluding, again, like Charlie mentioned, Vermont and Washington. So if you have an employee that's working remotely, decides to travel from Texas to, let's say, California to visit family, they need to go see a dentist, they're able to actually access through the portal a list of dentists that are in our network. And we have a very broad network ranging from New York all the way to California. So again, if you're traveling with family, this is where it comes in handy, because you could literally see a fee schedule. And we'll move on to this in the next slide, but they'll be able to access a fee schedule of what the cost is going to be within that zip code. So we can go ahead and jump to the next slide, Charlie.
Yeah, absolutely. So the goal of these next few slides is to show you again the three different plans that are included and a brief overview. We'll start off with our dental and vision plan, which a lot of groups go on. It's going to have our Careington Dental Network, and then we partner with VSP, so that it's going to be a VSP vision discount plan. As Daniela mentioned, our fee schedules are transparent. So what that means is they are able to see, let's say they're going in for a vision procedure, they're able to see exactly what they would pay for their frames and lenses or for the exam. If they're going in for a crown, let's say on Careington, or a teeth cleaning or filling, they're able to see exactly what they pay. We're very proud of our transparent fee schedules. Many of our competitors in the discount space, and many of you, if you have sold discount plans in the past, a lot of complaints from our competitors or from the competitors' customers is that there's no transparency. So our competitors will give a very vague discount range, but then the customers have no idea what discount they're going to get. So let's say if they give a 20 to 40% discount, they don't know what it's going to be whenever they go in. Whereas when your groups or when your customers are working with us, again, they have those transparent fee schedules, and it puts them much more at ease whenever they go in to get those services done. All right, so the next plan is going to be dental vision plus telemedicine. As you can probably guess, the big difference in this plan is adding that telemedicine on there, dial care telemedicine. Again, it doesn't cost anything to speak to a doctor, phone or video consults. So after the employees enroll in this plan, they will get an email from dial care saying, congratulations, you have access to dial care. They'll register their account online. And then shortly after have access to visit with the licensed physicians. If needed, they do the consult. Let's say, for example, I use this quite a bit for me and my kids. My son woke up in the middle of the night with an ear infection. We called the doctor, told the doctor what was going on. He said, from what it sounds like it's an ear infection, and he sent prescriptions to our local pharmacy. My kid was able to stay in bed, so we didn't have to drag him out of bed. We didn't have to have him go into an emergency room for 2 hours. A great thing for mom and dad, instead of at 3 a.m. going into an emergency room and paying, probably pretty close for $1,000. We stayed in the comfort of our own home. Again, called the physician, picked up the prescriptions shortly after at our local pharmacy. So that's the way to do it. So now, sometimes the physician will say, you know what, I don't think a medication is needed. So they're not always going to send a prescription, but certainly that's a huge benefit to this, is visiting with the physician and if needed, getting those prescriptions very soon.
One other thing that I'd like to mention about this plan that through my personal experience as well, is that, Charlie, you mentioned you had children. Great point. My daughter got sick, again, staying in the comfort of our own home. But what really saved me time, and really not to put my daughter at a disadvantage by bringing her out of the house, I was able to obtain a doctor's note through my portal to send to her school. So she was able to get an excused absence. So through the telehealth service, always ask questions to that doctor if you have children or a spouse, if they need a letter written, to see if they're capable of doing that. In my case, it was. And that saved me not only a trip to the doctor's office, but it also saved me the copay of having to pay the doctor, then the doctor bill, and also receive the doctor's note for my daughter, which I found very, very, very helpful.
Sure, absolutely. Yeah, I would say with telemedicine too, we get asked quite a bit, why would my employees need this, or when would they use it? So obviously, if you have young children, I have 4 myself, so it seems like they're constantly bringing something home from school. But if you're traveling, I know I was on a work trip to Chicago and came down with a sickness. So from the comfort of my hotel room, even though I was way away from Texas, where I'm located, I was able to use the plan. So if you travel, if you live a long way away from your physician, if you're in a rural community and you need to visit the physician, again, instead of driving an hour to your physician's office, you're able to use it. If it's after hours, the scenario to where it was 3 a.m. with my son, after hours, this is a great way to use that and get quick service. And then more than anything, especially in the COVID world, I don't know about you, but I don't want to go sit in a waiting room with 10 or 12 other sick people. I know they're being more careful about that, but you go into a doctor's office, even if they're regulating the amount of people in there, you're sitting in a room to where other sick people have been, you're passing by other sick people, and nobody wants that either. All right, so telehealth with healthcare assistance, it's the telemedicine, what Daniela and I have been talking about. You know, the big thing with this plan, there's not going to be dental and vision. So every once in a while, there's going to be a group that says, you know what, the dental and vision, I don't want to mess with. But definitely the telemedicine part of things is something I'm interested in. This is going to be the plan for those groups of yours. You know, it has prescription discounts. It has various other products in here. The healthcare assistance portion is great because they can help schedule appointments. They can review your medical records and different things like that. So the advocacy part of this is huge as well. Okay, so when we talked about transparent fee schedules, you know, this is an example of strictly the dental side of things. For time's sake, the vision and other fee schedules, we you know, we left out for the moment, but this is what we're talking about for transparency. So an adult teeth cleaning, if you had an employee that didn't have any plan whatsoever, they were walking into an office, walking off the street into a dental office, did not have a plan, they're typically going to be paying around $132 for a teeth cleaning. If they had our plan though, instead of $132, they're only paying about $60. So you can tell that's a huge savings, over 50% in that scenario. So that's an adult teeth cleaning. We get asked though, hey, you know, Charlie, that's great. That scenario with the teeth cleaning is great, but what about the more expensive procedures? Does it include root canals? So of course, the answer again is yes. You save money on any dental procedures you get done. But second one to the bottom, that's going to be an example of a very expensive procedure, a molar root canal. You walked into an office off the street without a plan, you're going to be paying around $1,400. With our plan, only $726. As you can tell, again, a huge savings, regardless if it's a very simple.
I think what Charlie is trying to say is, I think we lost Charlie for a second, is that basically with our plans, your clients, your employer groups, your individuals could save anywhere from 5 to 60% on the plan through Careington. Are we able to jump to the next slide? My apologies for those that are on. It looks like we are encountering some technical difficulty. If you can give us one moment and we should rectify this in just a second. If everyone on the webinar can just bear with us for one moment, I'm going to take over the presentation from here. We are trying to get the slides to be changed. I do apologize. We are at the end of our webinar. If you can just give me a couple of minutes and hopefully we can get someone to change the slide for us. Thank you for your patience. I did want to mention that for the conclusion of the webinar, please feel free to connect with Charlie and I via LinkedIn. Would love to get to know you, your business. Building a relationship is very important to me. Again, my name is Daniela Biondo, and I do work as a national sales representative. And please feel free to go ahead and reach out. Okay, everyone, it looks like we should be getting to the next slide in just a second. Again, I do appreciate your time and thank you for your understanding. Okay, so we are past the Max Care Network Savings Plan, and we'll go ahead and jump to the next slide. As far as questions, we are a very progressive company here at Careington. So if there is a product that your employees are inquiring or they would like to see wrapped in or bundled in a benefit package, if you're a broker that's on the call and you're getting requests for a product, again, like Charlie had mentioned earlier, we have over 250 products in our portfolio. Please do not hesitate, reach out. Any feedback would be appreciated. My email, you can always reach me, danielleb@careington.com. You will also receive this information in a follow-up along with a survey. Again, I do apologize for the inconvenience of losing Charlie earlier, but I hope everyone has an excellent day. Thank you for joining us, and I look forward to getting to know you, your company, and hopefully be a resource and positive advocate for your company. Thank you.